So welcome everybody to our Talking Public Health seminar. And today we have the pleasure of having Dr. Pasquale Rummo present for us. Dr. Rummo's research involves examining the impact of food policies and programs on diet practices and nutrition-related diseases. That includes financial incentives, behavioral nudges, and nutrition labels. He's also interested in assessing the implementation of policies and programs. And he's particularly interested in mitigating disparities and the impact of healthy eating strategies on vulnerable populations, especially low-income and minority groups. He's currently an associate professor at the School of Medicine at NYU, and he has his PhD in nutrition epi from UNC, that lousy basketball school. Matt's not here today, so I went after Rachel and Steph. Okay, so I'm going to turn this over to Dr. Rummo, and after that introduction, especially you're from UNC, so
yes, totally. I am.
Okay.
Some of my fellow students are here. Is and the mic is on? We're good.
Yeah, you're good.
Great. I'm excited to share my work. I'm delighted that you're having me here. I'm delighted to talk about it. We'll be talking about strategies to improve healthy eating behaviors, sort of strange bedfellows with some of the new strange priorities of the federal administration. And, we'll see how all that goes. But a lot of my work is about food and nutrition policy and specifically how it can help people with lower income eat healthier. So just starting with some basic table setting, we know that the food system and dietary behaviors affect nutrition-related disease risk. So poor dietary choices lead to key risk factors like hypertension, high cholesterol, obesity, and inflammation that lead to nutrition-related chronic diseases like CVD, diabetes, and cancer. And so there are several different types of nutrition policies and programs out there that are designed to support healthy eating, and that's the type of thing that I study. And so I like to orient people and orient this presentation by talking about 6 big buckets of the work that I do. And so I'll be walking you through these buckets in the presentation by first describing what the policy or program is like, from nudges to restrictions, and also giving a spotlight on my research and how it touches each of these broad buckets. And I orient it this way because I have a K award that's actually ending this month. It's a training grant, and part of that training is in behavioral economics. And as part of behavioral economics goes, you orient things based on least paternalistic to most paternalistic. And I use that, it's a loaded term, of course, but I use it in as neutral a way as you can to describe strategies where there's no forbidding of options and no restriction of choices, and no involvement of financial incentives or disincentives, all the way up to restricting options, which would be the most paternalistic. So I just think it's just the way that I prefer to orient some of this work. So I'll start with nudges and we'll end with restrictions. And with nudges, I'll be talking about some of my work related to online grocery shopping and some of the experimental work I've done there. Then I'll be talking a little bit about availability and looking at subsidies for new and renovated supermarkets and high need areas. Then I'll be talking about information strategies like warning label icons and calorie information, incentive programs. So these will be financial incentives for people to eat healthier, especially those aimed at SNAP participants. And then I'll end by talking about disincentives and restrictions, and coming back to information based on a new R01 grant that I have that incorporates all policies combined together. So this is sort of a little visual table of contents. So let's start with behavioral nudges. I like to sort of read this out loud and then unpack it a little bit. I think it's important. So nudges are any aspect of the choice architecture that alters behavior in a predictable way, and you're not forbidding any options, and you're not significantly changing economic incentives. So this is a little bit of what I said at the top in terms of orienting the types of policy actions that I consider. And I think when it comes to this definition, the first thing to point out is choice architecture. That's how we navigate the world and how the world presents options to us. So when you think about choice architecture in a brick and mortar store, for example, you're talking about how the shelves are designed and what's on those shelves, what's at eye level, what's in the checkout lane, That's choice architecture. When you're talking about online, it's how your options are oriented when you come to a landing page, when you're navigating aisles. So that's what you would be changing. And altering behavior in a predictable way would be, for example, putting the healthier options front and center versus not. And then you're not forbidding any options. So this is, maybe you're changing the default options, but you're not actually restricting anything. And you're also not making anything cheaper or anything less expensive or more expensive. So the classic example of a nudge is organ donation. In the States, it's opt-in. So when you're filling out your paperwork, you indicate that you want to be an organ donor. And then in other places, it's opt-out. So in a lot of places in Europe, for example, you would have to make the active step of unenrolling in organ donation. And unsurprisingly, that leads to higher rates of organ donation in those places that are opt-out versus opt-in. And you could see, I was riding the Metro North a couple weeks ago, and this is a new advertising aimed at the Wall Street crowd, promoting organ donation because rates are low. And so that's organ donation. A more recent, relevant recent example in New York City and other places across the country are healthy default beverage laws. So these are laws that change what options can be listed as the default options on kids' menus at restaurants. And so there's standards for that where you can have soda, for example, but you could still order it for your child. It's not forbidden. A parent can, or any caregiver can order a soda for their child, but it's not going to be on the default. It's not going to be a default option on the kids' menu. And so those past a couple of years, in 2019, I provided some testimony to support this. And this is going to come back later on when I'm talking about restrictions, because they just submitted a cleanup bill for this. It's all come back to that. In terms of the research I've done, this was part of the training grant that I got. As part of that, I've developed an experimental online grocery shopping platform that I call Lola's, or we call Lola's. So I did this with my colleagues at UNC, and it mimics. I'm going to give you a visual of this in a second, so it's going to be easiest to understand it. But it mimics a really big online existing online retailer. And we've run a couple of different randomized controlled trials in this setting. This one was funded by the Robert Wood Johnson Foundation, and we recruited lower income parents and caregivers and put them into our store and said, shop for 3 beverages for your youngest child. So these are people with kids between the ages of 1 and 5 years old. And in the control arm, it's just go in, here's your budget, get 3 beverages for your child. We didn't do anything to the store. And then the experimental condition, we tested 2 nudges. One was modifying product placement, another one was offering healthy swaps. So they got both of these together in the experimental condition. And it's about a little over 2,200 people in general. And so you could see this is Lola's. This is it mimics Walmart specifically. And you can see this is the experimental condition, and in this bulk beverage aisle, we've placed the products from healthiest to least healthy. So the healthiest products are listed first. That's water. Then less healthy would be 100% fruit juice, and the least healthy are the fruit drinks with added sugar like YooHoo and Capri Sun. So this is us reorienting the order of the products when you're online. And then we've also we also modified the landing page. So we made it so that the healthier products were on the landing page for those in the experimental condition, including water and milk products, with some language about how these products don't have added sugars, sort of like a indirect education piece there. And then there's the swaps. So if any parent chose something like Capri Sun, they would get this box would pop up and it would say, do you want to choose a drink with less added sugar? And on the left-hand side, we always offered a 100% fruit juice option. And on the right-hand side, we offered either milk or water. It would be random. And then you could see that we're only changing, we want this to only be a nudge, so we're not forbidding anything. They can click choose this, or past tense, they could click choose this, or they could click show me another to cycle through more options, or they could click no thanks and just say no thanks and keep what they've chose. And we tried to match it based on serving size, price point, et cetera. So it was optimized that way. And what we found was in the experimental condition, people ordered on average around 1,300 fewer calories from sugary drinks. This effect size is large because people are buying, a case of 100% fruit juice. So that's how you have to interpret it. This is not per serving. This is purchases. But still, this is a meaningful effect. And we saw that there was no effect on total beverage calories. So beverage calories stayed the same, which meant that there was substitutions more with unsweetened milk most of all, and also less so with water. Water, but less, but on average, not 100% fruit juice. So people were going for the healthiest options on average. So that's an example of nudges. Or my research as it intersects with nudges. The next bucket of policies are those related to availability. And so I mean this in two ways. This is the availability of supermarkets in general, and supermarkets that sell produce in general. So there's programs out there that subsidize the placement of new supermarkets in what some people call food deserts, for example, or renovations to the supermarkets to carve out spaces for them to sell fresh produce, which is not always a given. And so that's the availability of the food establishments themselves, and there's also what's available inside of those food establishments. And that would be, for example, Mayor Adams a couple of years ago passed new standards for the foods that are served in government buildings, like cafeterias. And this is some promotional imagery for that. And we didn't study any of that. But we did study the Fresh program a few years ago. So this is in New York City. This is exactly what the first thing I said. The first example, this gives subsidies for new supermarket placements, zoning incentives, and financial incentives, and also to renovate supermarkets. And we evaluated the impact of the first 8 programs of this type. You could see they're in each of the 5 boroughs, the first 8 ones. And we looked at its impact on the BMI of public school students. So my colleague, Dr. Elbel, he has access to fitnessgram data from the Department of Education. That's objective height and weight data for all public school students in New York, and most public school students in New York are lower income, just on average. So we know, and we also know where they live. So this red dot that you see here is the supermarket there zoomed in, and then we have around it, within half a mile of it, we know if a student lives close to it within that radius, and then we also know if the student lives outside of it. So we looked at the students who lived close and compared them to the students who lived outside of it to see if the placement of these new supermarkets or the renovations to these new supermarkets changed their BMI. And basically, we found there were mixed findings. So the ZBMI score was lower around 3 of the locations, the ones that I have circled in red here, but not around 5 other locations. And the effect size was relatively small. So it wasn't a really big impact on the BMI score. But all that is to say, so it didn't really move the needle too much on BMI scores for kids, but this is actually spearheaded by the Economic Development Corporation. So there are a lot of other benefits of this type of policy I want to note that I don't study specifically, but that there would be benefits to employment. So this is bringing jobs to neighborhoods, and this is also bringing community spaces. If you didn't have a supermarket, now you have a place to meet. So there's other benefits to these types of programs that are probably least effective when it comes to healthy eating and what I study, but maybe more effective in terms of community support in other ways. And so the third bucket of the types of policies I study are nutrition labels. Most commonly, this is calorie information. So this is an older image. You can judge it by the prices, of course, of a Taco Bell menu. And as part of the ACA, the ACA passing in 2017 or 2018, or when it went into effect, I should say, federally mandated calorie labels on all menus across the country, at least for locations that have chain restaurants. And this is about giving people information about what they're eating, both from a health perspective and also just from like a right to information perspective. That's how it was lobbied. And then more recently, there's been movement with warning icons. So these are sodium warnings and added sugar warnings most commonly. And you can see here, this is a menu in New York City. And this item has the salt shaker next to it. And that means that that item exceeds the daily recommendations for sodium intake. And so that's passed in New York City and prior to that, also Philadelphia. So that's in 2 cities right now. And most recently, as of November 2023, this is me providing testimony at the hearing. There's the country's first added sugar warning label policy. Dr. Mazuka and I'll refer to her in a second. We're also studying compliance with it. And it's requiring, it's just like the sodium warning icon, but it's now for added sugar. So if anything exceeds your daily recommendations for added sugar, it will now have this icon on it. And I'm going to show you what it looks like in a second. So it's going to require restaurants to post a warning label icon directly next to any item that has over 50 grams of added sugar, which is on the more liberal side. You know, I think the AHA is 30 grams, for example. So they chose a little, the higher amount. And it's going to be on menus, menu boards, item tags. So those would be things like if you're at a salad bar or something, or a Starbucks has an item tag, and also for combo meals. So if any one item doesn't exceed 50 grams, but taken together in a combo meal, it does go over 50 grams, it has to have the warning icon. And then it's also, we advocated for this as part of the public hearing process. It's going to be on online menus also, because that's obviously like where people place a lot of their orders now, even relative to a few years ago. And also at points of dispensation, like the soda fountain. And I was involved in the advocacy for it up here. So part of the testimony process and the public hearing process with input about what you see here. So we didn't get as many wins with the icon itself. So the icon is not what I would want as or I should say, not what is most effective based on experimental research. So it's black instead of red, for example, and the icon shows a spoon with sugar, and some people might not think that looks like sugar. I don't know how you feel about it. And it also, more importantly, doesn't say, high in added sugar. So there's no actual text. And I think that's the most important absence, I would argue. So this icon itself will be next to every menu item, that just like you saw the example of the sodium one. And then this text that you see here, that's like a legend or a key. It's going to be in one place in key locations like the cashier and the menus themselves. And this explains both what it means literally, this item has over 50 grams of added sugar. And then as part of the hearing process, we advocated for and were successful in getting them to put the health harms on it. So that it increases your risk. Like why does eating a lot of this matter to me? It increases your risk of diabetes, weight gain, and tooth decay. So this is the text, and the icon will be next to all the menu items. And I'm giving a lot of detail on this relative to the other ones because this is a big feature of my work right now. I just got last summer, got time-sensitive NIH funds to study this. So we have funding for 5 years through this mechanism, and potentially 2 additional years if we think of more ideas, because it's transformed into an R37. So open to hearing suggestions about what else we could do. But for the main 5 years, we're going to be studying its impact on what people purchase. I'll start by saying, of course, this is not only the US's first added sugar warning label icon, it exists in other places, but it hasn't been evaluated in other places in restaurant settings. And it's only in a couple of other countries. So our goal is to assess the impact on what people purchase, how much sugar they purchase. And we're going to be doing this in restaurants in New York City, and also restaurants in a bunch of different comparison cities like Chicago and Philadelphia, et cetera. And we'll be doing this before and after the warning labels are implemented. So a classic difference design. And we'll be doing this with both primary data and secondary data. So I'll walk you through the primary data first. We'll be using M4, which is a national online panel that has participants that they solicit to participate in studies like this. Other ones that you might be familiar with are like Cloud Research, Galloway, Dynata. They have online panels of people that you can recruit to do this. And M4 is unique because they have the Surveys on the Go app, and they also geofence locations. So if you're a part of this panel and you have the app, if you go into an eligible location, so we give them a list of all the places that will get this icon. If you go into a McDonald's, you'll get a ping, and it'll say, hey, do you want to participate in the study? Hang on to your receipt. So speaking of receipts, we'll be collecting those receipts. In order for them to get the incentive, they're going to have to take a picture of it and upload it, and we'll authenticate it and then find out how much sugar they purchased from all the items on the receipt by linking it to nutrition data. And so our goal, or what we proposed at least, is to collect these receipts from 10,000 people, and that would be 2,500 per group per time point. So intervention comparison before and after, DID model. So what we proposed was 2 waves of baseline data and 2 waves of follow-up data. The rule was issued in September of 2024, and restaurants have till October 2nd of 2025 to comply. And everything we're hearing from advocacy organizations and the restaurants themselves is that they'll wait till the last minute because they don't want this to happen. And that's what happened. That's what happened with the sodium warning label. So other goals for the study beyond just the impact on everybody, you want to look at, there's evidence from when you look at experimental research, there's evidence that the impact might be larger for those with, smaller for those with lower education or lower income or non-white customers. So that's one aim. And then we also want to look at potential mechanisms. So my colleague on the project has a background in health psychology, and we want to look at the ways in which these warnings affect thoughts, feelings, and beliefs about added sugars and their risk for their health risks. And so we'll be doing that with a bunch of survey questions. So the great part about using primary data for this, or part of the reason we're using primary data is that we can find out information about the people themselves, the customers. And so, unfortunately, progress with M4 has been very slow. It's an order of magnitude lower than it needs to be. So right now we have about only 200, I didn't update this number, I apologize. I just did this morning. It's 238 people as of this week, about half and half from New York versus Chicago and Philadelphia as comparison groups. So now we've started this a month ago, and we're hoping to get things rolling even more, but we've moved on to plans B, C, and D. So we're going to continue to get as many people from M4. We're adding the other online panels that I told you about. We'll need to do extra things to verify that the receipts come from actual eligible locations, since we can't actually ping them when they enter them. We're posting ads on social media, including Facebook and Instagram. This is a mock-up of how it might look on an Instagram story for our study account. And then lastly, where we anticipate making up the most of getting most of our data, and something we've been putting off as like a last resort, is like in-person street intercepts. So this will be teams of 2 trained interviewers, research assistants, who go out into the field and solicit receipts from people by either standing outside of restaurants or standing inside of the door at restaurants. And so they'll approach people and invite them to complete the survey for an incentive, and to give them the receipt and take pictures of it and complete our survey. And so that's where we are right now. And we're planning to account for this by making sure that, we collect the same amount of data by mode, by city, and time point in the follow-up period, just to make sure that, we're not introducing any bias. On top of this, we also have secondary data, and this is not something that's started yet, but we have a fabulous relationship with the Taco Bell Corporation. And I say we, this is my colleague, Dr. Elbel. They have given us access to all of their transaction data from as far back as 2007. And so it's a treasure trove of data. Brian Elbel, my colleague, he has used this data. He's the PI of these grants, but we've studied calorie labeling policies using it, and soda tax policies. I've helped to lead several of the papers from these grants, so I'm familiar with the data. And the soda tax paper right now, it's under review, so we're hoping to get that out soon. But those grants will end, and now I'm using these data for this third purpose. And it's especially good because, I don't know if you know, but half of the US population eats Taco Bell at least once a month. So it's actually like more generalizable than you might think it is. I don't know if how people here feel about Taco Bell, but they've done a great job, I think, of promoting themselves. So and I think just overall, this is a great complement to the primary data, because we won't know anything about the people who make the transactions. This is just receipts, but we'll have all of the receipts from one location. So, it's not just some receipts from some locations. And again, we'll use a difference in difference model to assess the impact on total sugar purchased. On top of that, with MPI, Dr. Mazuka, we have a grant from Bloomberg to assess compliance with the study. So actually, just this next Tuesday, I'm going into the office, and we'll be starting training for the RAs. We want to, with their help, assess basically the extent to which people are actually implementing these warning icons the way that they're supposed to be. And we'll be going into 100 restaurants in New York, and we're just mapping them now. And 100 restaurants in Chicago with our team at UIC. And we're doing this both before and after the policy. So again, difference in difference approach. And basically the research assistants will go in and take photos of everything. So all of the menu boards, including the drive-through setting. So we'll be taking pictures of it. We'll be evaluating, are they on all eligible items? Are they not on ineligible items? I've been on Burger King's Grubhub site in New York City, for example, and they just put the sodium warning on everything, which basically makes it, that it's not on anything. So we want to make sure that it's being appropriately implemented. And then after we do the in-person audits, we'll be doing online audits for Uber Eats, I think. And then that's compliance. So I'm the key person in charge of that. And then Dr. Mizuka is in charge of studying the aims related to implementation. So we'll be looking at implementation outcomes associated with the policy, acceptability, appropriateness, feasibility, cost outcomes, and then also describing strategies to support how the policy was enacted and implemented. And so we've primarily begun to bring stakeholder names together based on existing relationships. We've developed a protocol we're reviewing now, and so everything's in motion to be done in the next couple of months. So that's information. That's a large part of my work. I spent a lot of time on that, a little bit less time on these next things. But nutrition incentives, I've done a lot of this over the years. Right now, I'm working primarily in Rhode Island, and I'll get to that in a second. But basically, these are ways of making healthy food cheaper, especially for those who have a lower income. So a lot of these types of programs apply to those who get SNAP benefits. So SNAP, is a hunger relief program in our country, potentially going to get hacked, in the near future, which is really unfortunate. Fingers crossed that's not as bad as it could be. But it's designed to alleviate hunger. But it's not designed to improve nutrition security and healthy eating. So cost is still identified as a barrier to healthy eating, even with people who get SNAP benefits. So that's where these nutrition incentive programs come in. They date as far back as 2009. They got their start in farmers markets in Detroit, and they've expanded to supermarkets across the country. And it's sort of, the details differ from program to program, the logistics of them. It's a little bit of a BOGO situation where, you not buy one, get one free exactly, but, they're matching your dollars. So you spend $10 on eligible fruits and vegetables, you get $10 back to spend on more eligible fruits and vegetables. And then there's usually a ceiling. So this one's pretty generous, it's up to $20 per day. It's usually a little bit lower. And so I've evaluated different versions of this program. In Rhode Island, I helped to evaluate the Food on the Move program, which is a mobile produce market. It was designed for specifically this population that lived in low-income housing units in Providence, specifically for older adults who might have mobility limitations, can't get to the supermarket very easily. So enter the mobile produce market. And then on top of that, they tested out a 50% discount incentive for those who use their SNAP card when they went to the mobile produce market. Found it was very effective. They spent at least, on average, $11 more per transaction for those who were using their SNAP card. So a little bit small scale, but it did lead to, that was used as pilot. Those findings were used to inform the passage of the Eat Well, Be Well program in Rhode Island. So this is the country's first statewide nutrition incentive program. This just launched in January 2024. This is me at the launch at a Stop and Shop in Providence with Dr. Amy Nunn, who is leading the project. And it launched, any retailer is invited to join. It launched with Walmart, Stop and Shop, and Shaw's. Those are the three biggest in Rhode Island. And it's a smaller incentive than we care for it to be, but this is a pilot informed by a pilot, which will hopefully lead to something bigger. But it's 50 cents for every dollar spent, and it's only up to $25 per month. So it's not the biggest incentive, and that's part of what we want to change. And like I said, it's temporary. It's a one-time state budgetary appropriation, and it's just use it until it's done, until the funds run out. So I consult with, and we are contracted to, as part of the Rhode Island Public Health Institute, to look at the impact. So we're in the middle of doing that now, collecting data. This is us collecting, or not me, but the research assistant collecting data at a Stop and Shop. So we'll be looking at its impact on food security and produce consumption before and after, and also gather lessons learned through using implementation science frameworks and approaches to promote Rhode Island as to give lessons learned to other states. But as a first step, we looked at awareness and satisfaction, and we found some pretty key differences by race and ethnicity in terms of who was aware of the program. So it was 60% versus 40%, white versus non-white were aware of the program. These are the SNAP participants in general in the state of Rhode Island. And that 64% of non-Hispanic versus 36% of Hispanic people were potential participants were aware of it. So this has led to a shift in changing more targeted outreach and outreach efforts to get people more aware of the program. So that's incentives. Then there's the fifth bucket that we have here is nutrition disincentives. Cut back to me studying soda tax policies. This is making unhealthy food less affordable. And so the most common strategy here that we've seen in most places that stalled out for a number of years was taxes on sugar sweetened beverages. Like I said, the last one was 2017, but we just got a new one this past election cycle in Santa Cruz. So there's been a resurgence in trying to get these types of taxes out there. Philadelphia is a key example. They have great synergy where the revenue goes to universal pre-K and other community infrastructure. Then there's restrictions. These are things like healthy checkout aisle regulations. You might have come across this or heard about it, but in Berkeley and Paris, California, the two locations so far that have passed this in the country, is that it's basically restricting these types of foods from being in the checkout aisle. There's metrics like this many grams of saturated fat and or this many grams of sodium, all that type of, those are the rules that you'd have to abide by. Of course, they're working their way around it by putting things close to the checkout aisle, but not exactly in the checkout aisle. And then there's restrictions for children's meals served in restaurants. So this is me testifying yet again in support of basically what I view as like a cleanup bill for the healthy default beverage law. So what I didn't mention then was that chocolate milk was considered healthy for that 2019 bill because it has vitamin D, which is fair. I mean, it's healthier than soda, but still not healthy. So this is removing it entirely as being an option that you could give to children in New York City chain restaurants. Also having a max size on the 100% juice options that they would serve, and then some other standards for the meals. So this was just introduced and keeping an eye on it. We'll see if it passes. And so those are the 6 categories. I like to end by saying that this might be obvious, but like only one of these, just having one of these policies is not going to solve obesity, of course, or make everybody eat healthy. You need to combine policies for any sort of meaningful change, which is difficult because there's only ever really political willingness for passing one thing at a time. So sometimes, the best strategy might be to pass a suite of policies at once. And this is what happened in Chile. They're sort of the gold standard when it comes to this. As far back as 2014, they passed this omnibus legislation that includes taxes on sugary drinks, the first ever like countrywide mandatory front of package menu labels or product labels. So these have warnings for calorie, saturated fat, sugar, and sodium. Those are the 4 that are usually the most popular. And they come together. So you'll see all 4 on any one item that would have all 4 of them. And then also prohibiting sales of unhealthy foods near or in schools. And then the same for advertising that targets unhealthy food advertising that targets kids. And so others have studied its impact and found, at least in the first phase, that it had a really big impact on what people bought, at least in store settings. So this is from this is purchases from grocery stores or a grocery chain. So reduced all of the targeted nutrients by a lot. And so we used that. My colleague, Dr. Roberto from UPenn, and I submitted an R1 that we recently got where we'll be running our RCT and testing this specific suite of policies of 3 healthy food policies, sort of similar to Chile. We've added healthy checkout regulations here in online settings. So the experimental arm will get all 3 of these. The control arm will get none of these. And we're looking at what people purchase and also their dietary quality. We'll be using 24-hour dietary recalls. And we'll be doing it in both the Lola's grocery store that I mentioned at the top of the presentation and we've been working on for the past year and currently about to run a validation study for an online restaurant delivery app version of it. So this is now an experimental restaurant delivery app, Grub, obviously like Grubhub. I'm used to saying Grub, that mimics that. And test it, say it again. This is the study overview. We're recruiting 300 people. This is a lower end because we're actually going to be sending them all the groceries for several weeks and sending them lunch from McDonald's for several weeks. So you can see here, we'll have 150 in each group. And the first week, it'll just be like a run-in week. We'll tell them shop for your groceries for a week with a limit. Also place a lunch order, and we'll place it for you and it'll be delivered to you, but at whatever address you want. And then weeks 2 to 6, we're adding our interventions. These are the 3 policies that I mentioned. It's the warning labels, it's the taxes on added sugar. Oh, sorry, I skipped over that, but we're actually expanding it to be taxes on ultra-processed foods, not just sugar sweetened beverages. So it's going to be a wider range of items. And then banning advertising in the advertising of unhealthy items in the checkout aisle. And at the end, interestingly, we're going to test the effects of counter marketing. So we're going to try to anticipate what industry would do to counter this and put that in, add that in week 7 to 8 and see if it blunts the effects or to what extent it does. And so this is the app. I have a little video. I don't know if it's going to work. This is beta is being generous. It's okay. It looks like Grubhub. If you ordered at Grubhub before. Okay, so I'll end by saying some of where I see my work going in the future. That I will be shifting my focus to ultra-processed foods overall. That has been popular, and also testing strategy, like that has been growing in popularity, I should say, as a strategy from the policy perspective, not just researchers, and testing strategies to curb purchases online. Growing portfolio of qualitative research projects. So I'm already assessing the implementation of the Eat Well, Be Well program in Rhode Island and then the Sweet Truth Act with a colleague here, and hope to continue doing that. And then lastly, looking at strategies that are designed to improve dietary behaviors and designed to mitigate climate change impact. This is born from a relationship that I'm recently developing with some colleagues in Switzerland, where they have 2 different labeling systems. A through A, I think it's A through D or F, A through F. A through F for like whether this is healthy to eat, and then A through F for whether this harms the environment, and they want to integrate those into one label because you could look at something and see an A and an F and not know whether to buy it. It's confusing. So we're going to be designing a pilot study to test out that warning label. And then just thanks to my teams. That's it. We'll field trip to Taco Bell in Times Square.
So first, wow, this is awesome
Yeah.
and very exciting. As a recovering tobacco control policy researcher, I see so many likenesses and potential things to learn from tobacco control policy
Warning
research.
labels especially.
Yes, warning labels, but also sort of a lot of this work is starting in progressive cities where, obesity and consuming bad food is not as high as some of the other places that are not as progressive, as we also saw in tobacco control.
Mm-hmm.
And so I don't know if this is as much of a question as like imploring you maybe to try to test it in other areas or figure out ways, or maybe this is a dissemination and implementation where we figure out how to diffuse this information, kind of diffusion of innovation theory type of thing, to other places so that it's expanded upon, right? So that you're meeting another population. So that's just one thought. And then the other is, with your suite of policies, the immediate thought comes to agent-based modeling, and they've done that a lot in tobacco control too, where they test taxes plus retail location plus, I mean, a lot of plus graphic warnings plus, you know, this or that. And I wonder if there's an application here, especially since you have so much rich data and secondary data, if there's a possibility of that. So we get to have dinner together tonight, and I'm so excited to talk to you about this, but.
Sarah, right?
Yes, Sarah. So I don't know if you can comment on some of those, if you've been thinking about some of those pieces or not.
Both, yes.
Okay.
Great points. Yeah, in reverse, agent-based modeling, there's definitely a sliding doors scenario where I pursued that for my K award. It was on the short list. I went in the direction of behavioral economics and psychology.
Okay.
For the best, I think. But yeah, I'm open to that. Yes, is the short answer. And yes, we specifically, so your point about diffusion and using implementation science to figure out how to bring this to other places, I agree with. That was part of the rationale for going in that direction. Also part of the remit of the contract, like the Rhode Island contract, sort of set me on that path. And it's also informed how I'm approaching some of my newer projects. So the R1 that started this past summer, we're specifically recruiting from Houston and Dallas. I should know this. We haven't actually started recruiting or anything like that. Places where not only is the eating a little bit poorer than you would say like New York City, but also where there are a lot more McDonald's and Walmarts, for example, where it would be more relevant. Yeah, so it's stuff I've thought about for sure.
Thank you. I really enjoyed that. I have a question, perhaps more conceptual. I was a bit surprised that you list nudges as less paternalistic than, say, information. Can you just explain that logic to me?
That's a great question. I would also acknowledge that whether you think something's more or less paternalistic will probably differ among everybody here, like how you would rank those items. I suppose when I think about information, I'm also including the warning labels, which are often a little bit more like scary, for lack of a better word, and you're trying to put some fear of a health outcome into people versus just subtly changing their environment in a way that one might argue is arbitrary. So when you think about choice architecture, how we design the world is, you know, I could design an online store and be like, just put the products wherever you want. But like there's a mind behind how that's designed. And I think that's a little bit usually more less intentionally trying to shift, I don't know how to articulate it.
It's an interesting question, right? It's like what's more paternalistic? Like scaring me into volunteering my organs or taking my organs? Because check off the box. It's a conceptual question.
I think an extreme example is appropriate. Like it would be, you know, saying, here's your organs, and you're either going to tell me I can take them, or you're going to tell me I can't take them, or something like that. And then the warning icon would be like, if you don't give this to us, then this picture of this child, you know, will lose their organ. So I started thinking about it that way. Trying to be very extreme, and that I don't endorse that.
I actually think that interesting conversation obviously doesn't affect the science that you're just describing, but I think it's an interesting question for public health about right, what approaches one endorses, and there's obviously no clear answer because as you said, it changes for different groups, changes for different times. But
and it might be different within bucket too.
You
know, warning icon is different than calorie information.
Yeah, no, and organs different than beverages. But I think it's an interesting question. I think us being deliberate and thoughtful about it is, of course, one approach that we need to keep at the forefront at a time of diminished trust in public health. So I really appreciate your scheme. So thank you. Yeah,
I say it from the perspective of trust a little bit and trust of government. You know, the paternalism is I acknowledge it as a loaded word because it's political at its core. It's about how much you want the government or any body organization to tell you what to do versus not. In some places, some people might argue that, I don't know, a tax might be giving you more freedom to live a healthy life, for example, or forbidding people from using their SNAP benefits to buy sugar-sweet beverages might be a way of giving people more freedom to live a healthier life. I don't know, there's different ways of thinking about freedom in this context, I also think.
I mean, labor, I think there's an argument to be made that the very existence of the state is paternalistic, and that's not necessarily a bad thing.
Mhm. Yes.
Thanks for excellent talk. I really enjoyed it and I'm impressed by the work. You know, I spent a lot of my time in business school, and so a lot of what you talked about really connected to things that we think about in terms of how companies make decisions in the face of non-market factors. And you mentioned several really good examples. Burger King listing all the labels with salt added so that they don't effectively have any impact of the fact that labels are there. Redesigning the checkout lane so that the definition of what's a checkout lane is in question, and you can put the candy wherever you want it. And I'm curious, when you do things like work with Taco Bell, to what extent do you talk to the companies that will be impacted by these regulations about their intended behaviors in response to them? And then at the same time, to what extent is that part of the things you watch in your studies and to pay attention to how their behaviors actually respond to the rules changing around?
Yeah, it's a great question. I think one of the more fascinating parts of my job. I think I'm not putting that in quotes, but like my work, I think it's fascinating, especially the variation across industry partners. So for whatever reason, Taco Bell, I mean, if we're ranking, you know, the relative harm of fast food companies, I think Taco Bell's a little bit better. They have or at least for now, have a part of their organization that is committed to healthy eating. That's the people we talk to. And so this representative, she goes back and forth to clear things. But we update them about everything and they give their input. And I know that we had to, you know, for example, we seek their permission and get, you know, an agreement about you will give us your data for this many number of years. And it was a very easy yes for calorie information and soda tax evaluation, but actually a little bit more challenging for the warning icon. They're definitely more scared of it. And it's been fascinating having those conversations with them, learning about what potential strategies they might use to undermine it, which has helped us to design tools for assessing compliance. Because when we think forward to the follow-up period, we want to think about what they might do. So for example, they might change their cups from 20 ounces to 19 ounces. That's one strategy that they voiced to us that they're probably going to do. So we're going to have to collect cups in baseline and follow-up, like physical cups, and weigh them and everything. So we are talking to them. We have partners and are talking to like Stop and Shop. They're very skittish about giving us their data. They basically have given us data that we could use to prove it's working to help their bottom line, but nothing related to health. Like they're holding on to that. So willingness to play ball is also different, even in a situation where to me, it seems like a very big win-win. You know, that's how we approach them in general. So this is good for me. This is good for you. Like the financial incentive programs, like we've had early talks with them that it's getting people in the door. Like they've seen a big bump in sales from it, and people will use their benefits and then leave and go back to their cheaper grocery store.
Yeah.
So they're getting people in the door. I forget your second question.
I think you answered most of what I was saying.
Okay.
I mean, I just think there's a really cool opportunity to collaborate because if the warning labels do what the intent is for them to do, consumer sentiment is changing, and that's something that companies ought to be aware of and then strategize around.
Yeah.
So you could just avoid it and continue running the same play, but if what your work is demonstrating is that consumers will actually behave differently given a set of market conditions, that's useful for companies to know and think about as they plan out what they're doing next.
In general, it's unfortunate because they can be so nimble, and
Right.
the policy process is so slow, and the research process is even slower. So it's hard, and that's why we're trying to bake in some of it into that R1. You know, mimicking industries, countermarking from the industry.
Thank you.
Welcome.
So first of all, thanks for being here and a great talk. I hope we're feeding you some good healthy food.
You are. I think well.
So my question is, and not that you need any more on your plate, but that's a bad metaphor. Mostly what you're talking about has been sort of health promoting, policy development, implementation, and enforcement. What about the flip of that, like policies that we have related to health eating that are not healthy? You know, agricultural incentives, policies for schools, policies for American Indian populations, especially reservations. Have you thought about some of those? Which one would move the needle more? Is it taking the Rhode Island idea and getting it to everyone? As Sarah said, some states are going to be a heavy lift on that. Or is it thinking the opposite? What are some policies you want to terminate or lessen or change in order to in order to shift away from some of the negative incentives that are out there?
It's an amazing question and one I get often and I have like not the best answer for, which is like, I am opportunity driven. And there's not those types of policies, I'm out here looking for natural experiments, right? So like this policy passes and then I study it. So in that way, I participated in the public hearing process, but that again, that's also a little opportunistic. I find out what is happening. I'm trying to work with advocacy organizations, but like to me, that's their role. So like I work with CSPI, the Center for Science and Public Interest. And they're the ones who are identifying the opportunities and nurturing them, and then they'll tap me in to be like, we want you to put your researcher hat on and say, how will this, will it, to what extent do you expect this to work? So that's sort of where I live in. And unfortunately, there are just no policies out there that are trying to change the agricultural system, especially because it's mostly federal. I mean, federal is just not something that is feasible to study right now or to change. It's like a lot harder to change that. So it is about more local policy, and locally that has been more of what we've seen here. But I would love to study something like that in general. I was going to say a second thing.
I was thinking especially of schools, because there's so much variation in what schools do. And like getting a handle on that, I don't know how many school districts there are in the US, but it's thousands and thousands.
Yeah,
Like,
the schools is definitely a category that I don't touch personally, but could if I wanted to. Like the school meals, I mean, that's a whole other wing of this type of research apparatus.
For your postdocs or something else.
Sure, yeah.
Well, that's great, thank you.
I kind of want to follow on Patrick's question about evaluating the, or to the extent that you, outside of the SNAP program, evaluate the impact on the, whoever's selling the food. And I'm thinking especially, to some extent, thinking back to the nudges versus information as being paternalistic, like to some extent, that choice architecture is already operating in a certain way, right? The store sets up its aisles and its checkout counters, right, with a purpose, and that purpose is to make money. And so to the extent that in your studies, you're able to look at the bottom line impact for the, so I'm thinking especially even in your like online store, where you could try to model out what is the impact on the business, because like Sarah was saying, like in New York, sure, this kind of thing may be able to be part of the policy, but if you could make the case from the business side that there was a reason to do this, or there was a way to do it that both made them look good and also didn't hurt at least the bottom line, that seems like really important data to collect. And maybe you're getting some of this in the implementation study from like a qualitative perspective, but if there's any actual cost information for the store, like what they would lose by implementing the policies.
Yeah, that's a great point. It's so we look at, how we look at basket totals, but it's never our primary outcome, and it's never something that we're promoting or disseminating. So that to me, it's a great point. And to me, it seems more like a problem of my problem to fix with respect to dissemination and my relationships with industry versus, the design of the study. But I think that's a great idea. I also think I need to probably, in order to effectively do that, link with people who do more cost effectiveness expertise.
Yeah, and I wonder, thinking if you had some of that business perspective from the grocer side, like whether basket total is the relevant metric for them, because there's a lot of different things that happen between food and drink and what price it's put at. So
Remind me of that when we talk about it.
yeah, I know, I can't wait. I have a whole page of
I think to that end, not to be self-promoting to the interests I'm here to represent, but I think partnering with the business school and saying someone in the strategy or marketing group that can take your data and say, what's the margin difference in these decision choice architecture scenarios could be a really powerful way to depict to industry what the impact really is, and then to think about ways to tweak it so that the impact is not as negative as they feared it would be.
Yeah. And I worry, and it's also just the reality that some of them are going to be less appealing for that reason. The warning icons, for example, I think might actually hurt the bottom line. So I don't know. So you might need to be thoughtful in how you wield that sword potentially, but I think it's a great idea.
Have you run into any retailer incentives from a person not in recovery from tobacco control yet. Retailers get paid to put Marlboros in front, right? Does that happen with
The
food?
slotting
Like,
fees, yes.
product
Slotting fees
placement
exist now,
and
yeah.
things, and so is there pushback from retailers because they're losing money that way? Do you run into that or?
I know my colleagues in California have run into it with the healthy checkout aisle stuff.
Yeah.
Yeah,
Yes.
it's slotting, yeah. Me personally, no, though.
Okay.
Yeah, I mean, the financial incentives one is the most, is interesting to me because it so clearly works and it's so clearly a win-win. That said, like, the solution is to give people more SNAP dollars, period.
Yeah.
Like, so we're sort of like dancing around that solution, in my opinion.
Thank you.
Yeah.
Question, if the virtual grocery stores, do they ever offer like more than like a one-to-one product? Is it like, could it offer like a basket of things? I'm thinking like Walmart, where they sometimes suggest recipes, or that could be like more of like a bundle of food maybe we see people to buy like more healthy.
Yeah, there's designs that incorporate like community supported agriculture that it's not exactly what you're saying, but it would be, you know, a bundle of at least like produce that you're getting at a discount that is facilitated through some produce prescription programs. But what you're saying that hasn't exist, but I think could be a great option, like where it's like it would have to be really up to the retailer, like that would have to be voluntary. But I know that they have expanded the scope of what's included. You know, the program in New York City, for example, includes lentils now for you to buy, not just fruits and vegetables. So I think that's a potential path to go down, you know, including whole grains, maybe.
Well, we want to thank you. Really, you have a lot of.